Hi, Eileen Veilleux The Fam here. Welcome to another installment in our mini mental health series. And in today's installment, we will be concluding our series on sleep terrors, otherwise known as night terrors. Before we begin, let me just remind you to please watch the full video because throughout the video, there's going to be 3 keywords. When I get to the keyword, I will say keyword, then what that keyword is at the end of the video in the comment section, along with the genuine comment about the video. Put in what the 3 keywords are to be eligible for my free merch giveaway when I reach 2,000 subscribers. So, excuse me, let's get started. How do doctors diagnose sleep terror or night terrors? Well, the diagnosis, sleep terrors, your doctor will review your medical history and your symptoms. Your evaluation may include a physical exam so your doctor can identify any conditions that may be contributing to your sleep terrors. Discussing your symptoms. Sleep terrors are usually diagnosed by your doctor based on your description of the event. Your doctor may ask about your family history or sleep problems. Your doctor may also ask you or your partner to fill out a questionnaire about your sleep behaviors. Keyword: nocturnal sleep study. In some cases, your doctor may recommend an overnight study in a sleep lab. Sensors placed on your body record and monitor brain waves, the oxygen level in your blood, heart rate, and breathing, as well as eye and leg movements while you sleep. You may be videotaped to document your behavior during sleep cycles. Sounds pretty easy. So how is this sleep terror treated? Is there any treatment for this? Well, treatment for infrequent sleep terrors isn't usually necessary. If the sleep terrors lead to the potential for injury, are destructive to family members, or result in embarrassment or sleep disruption for the person who has sleep terrors, treatment may be needed. Treatment generally focuses on promoting safety and eliminating causes or triggers. Treatment options for this may include treating the underlying condition. If the sleep terrors are associated with an underlying medical or mental health condition or another sleep disorder, such as obstructive sleep apnea, treatment is aimed at the underlying problem. Addressing stress. If stress or anxiety seems to be contributing to sleep terrors, your doctor may suggest meeting with a therapist or counselor. Cognitive behavioral therapy, hypnosis, biofeedback, or relaxation therapy may help. Anticipatory awakening. This involves waking the person who has sleep terrors about 15 minutes before he or she usually experiences the event. Then the person stays awake for a few minutes before falling back to sleep again. Now, the medications for it, medication is rarely used to treat sleep terrors, particularly for children. If necessary, however, use of benzodiazepines or certain antidepressants may be effective. So, what are some of the things you can do at home for sleep terrors? Well, if sleep terrors are a problem for you or your child, here are some strategies that you can try. Get adequate sleep. Fatigue can contribute to sleep terrors. If you're sleep deprived, try an earlier bedtime and a more regular sleep schedule. Sometimes a short nap may help. If possible, avoid sleep time noises or other stimuli that could interrupt sleep. Establish a regular, relaxing routine before bed. Do quiet, keyword, calming activities, such as reading books, doing puzzles, or soaking in a warm bath. Before bed, meditation or relaxing exercises may help. Make the bedroom comfortable and quiet for sleep. Make the environment safe. To help prevent injury, close and lock all windows and exterior doors at night. You might even lock interior doors or put alarms or bells on them. Block doorways or stairways with a gate. And move electrical cords or other objects that pose a tripping hazard. Avoid using bunk beds. Place any sharp or triangle objects out of reach and lock up all weapons if you have any. Put stress in its place. Identify the things that stress you out and brainstorm possible ways to handle the stress. If your child seems anxious or stressed, talk about what's bothering him or her. A mental health professional may help. Offer comfort. If your child has a deep sleep terror episode, consider simply waiting it out. It may be distressing to watch, but it won't harm your child. Excuse me. You might cuddle and gently soothe your child and try to get him or her back to bed. Speak softly and calmly. Shaking your child or shouting may make things worse. Usually the episode will shortly stop on its own. Look for a pattern. If your child has sleep terrors, keep a keyword sleep diary for several nights. Note how many minutes after bedtime a sleep terror episode occurs. If the timing is fairly consistent, anticipatory awakenings may help. Now, there's probably a lot more to sleep terrors than I was able to research. If there is anybody out there that is willing to do an interview with me here on my YouTube channel about what it's like for them to live with sleep terrors, please feel free to reach out to me because I would love to be able to interview you on this. In the first session of sleep terrors, I gave my example of when I had mine, but I don't live with it. Mine was caused by a traumatic event, and when I dealt with that event, they eventually went away. I don't have them anymore, but because of that and what happened to me, I still have, it's hard for me to fall asleep, but when I do, I can normally sleep pretty good. I do have some, like everybody else, regular nightmares, but I haven't had any sleep terrors in a long time. So if anybody's willing to do an interview with me on it, please reach out to me and let me know so we can get it set up. I'd be glad to go over some of the questions that I'll be just asking you about it. If anything is too personal, this is why, I will go over with you if you would like before the interview on what the questions are. This way, you can let me know that question's too personal and I can cross it off and do other questions to give people an idea what it's like living with sleep terrors without causing any more distress or discomfort for you. Before I let you go, I just want to remind you that you're all very important to me out there. Each and every one of you, because we are all uniquely made. And remember, this is a very rough time of year for a lot of people. Um, Holidays isn't always joyous for everybody. Just taking myself for instance, it's a hard time for me, but each year gets better and better. But it is still a hard time. There's people that don't have families, so it's a very lonely time for them. There's people that lost loved ones around the holiday times. That's very rough on them. Because it's not real joyous. They have a very sad moment that they have to, relate to the holidays. My throat's very dry. The air's dry today. So please keep that in mind with people and um, try to always see with your heart, not your eye, especially during this time of year because this is when we all need each other. I mean, we should do this year round, but sometimes the holiday time is very stressful on a lot of people and it can cause a lot more anxiety than a regular day would. And, try to be the one to help comfort somebody and cheer them up if you can, if you know they're down. Don't sit there, if somebody's lost a loved one, don't sit there and say, well, it's been 2 years or 5 years, you should be done mourning. Everybody's mourning is different. It may take them longer. It depends on how much who they had for support during that time of their loss. Always try to think of the other person, and that's what seeing with your heart is. It's seeing from down here and not your eyes. So until I see each and every one of you again, I love you.